Hi guys, welcome back to the channel, and this week's learning is a brief overview of multiple myeloma, what physios must know. So it also tells us what our roles are. We are not diagnosing multiple myeloma, but for some patients that come to us, they have not seen the doctor, and the first person they see is either the FCP or one of the physios who self-referral. So it is important to know or be aware of things like this, but we are not diagnosing. So we use the criteria SLiM-CRAB. So we're all aware of CRAB. So C is high calcium, R is renal problems, A is anemia, and B is bone pain. The SLiM that has been added, S stands for 60% of plasma cells found in the bone marrow on screening. Li stands for free light chain ratio of the involved light chain being over 100. And M stands for more than one lesion on MRI. In our clinic, we usually won't come across people with a SLiM part, although we might, but with CRAB, that's really important to remember. So the next part we can see here is a quick reference guide for physios. This will be downloaded as PDF on the channel, but we're now going to go through why we look for the CRAB signs and other blood tests. So multiple myeloma is a malignancy of the plasma cells which are found in the bone marrow. As we know, these cells usually produce antibodies to fight infection, but with myeloma, these can produce plasma cells of a single clone, and they are non-functional antibodies known as monoclonal or M protein. So this is why, in addition to other tests, we are doing the serum protein electrophoresis and the serum free light chain assay. Now, it's really important that if we only do one, so the serum protein electrophoresis, we are more at risk of missing the serum free light chain parts because that won't be picked up in the serum protein electrophoresis. In some hospitals, so where I work, we can't order serum free light chain assays, but there are hospitals that if a positive electrophoresis happens, it will automatically trigger a serum free light chain assay. So for us, if we can't use serum free light chain assays, we go for bench Jones urine. So the malignant cells, as they multiply, they start to physically crowd out healthy cells in the bone marrow. So this can lead to decrease in red cells, which can cause anemia and explain the profound fatigue that many myeloma patients experience. We can also have issues with decreased platelets, which could cause bruising, and it can also have an effect on our white cells and increase our infections, which again is also seen. So this is important because it explains why we need to perform a full blood count to monitor the red cells, white cells, and platelets. The other part of myeloma is the renal impact. So with light chains, they can be released into the blood and they can block the tubules of the kidney, causing significant damage. So we monitor this via kidney profile, looking specifically at serum, creatine, and creatine clearance. So that is why we do a kidney profile blood test. Now, interestingly, when we do bone profile, alkaline phosphatase that's included is usually normal. Now, this is because when myeloma cells are released, they stimulate osteoclasts, that are the cells that break down bone. Now, this releases calcium in the bloodstream, leading to increased calcium, so which is why we do a calcium blood test. Symptoms of hypercalcaemia can include increased thirst, polyuria, kidney stones, bone pain, nausea, and confusion. Now, this is where the sentence stones, bones, moans, and groans comes from. Now, alkaline phosphatase is usually normal in our bone profiles. Now, this is because in healthy bone, there's a break called pyrophosphate that prevents bone formation. Usually, osteoblasts release alkaline phosphatase that essentially turns the brake off, allowing bone to be built. However, because myeloma inhibits osteoblast activity, the alkaline phosphatase is not released, the brake stays on, and the bone cannot repair itself. So this results in the characteristic punched out lytic lesions. So this is why we have the CRAB, the high calcium coming from the bone, R for renal because the light chains can affect the tubules, A, anemia due to the crowding out of the red blood cells, B, the bone pain that we've talked about, and we've already mentioned the SLiM criteria. So really important that if we have patients that come in with bone pain, generally feeling unwell, and have some symptoms that might make you think about this, then we are straight back to the doctor. Okay, so safety note, because this is beyond the scope of standard physiotherapy or FCP assessment. So if you identify any of the CRAB criteria, or you have a high clinical suspicion, you must seek an urgent GP opinion. The GP will then decide on the definitive medical management and facilitate the necessary referrals to the necessary specialists. This isn't us. So I hope you found this very brief overview of multiple myeloma useful, and in particular, why we order the bloods that we order. If you've liked it, please like and subscribe, and I'll see you next time.